Sego, Skanagoaga. Welcome to the 2022 ACF Indigenous Programs Conference. Our conference theme is supporting, celebrating, and sustaining our Native American and Pacific Island communities. Next slide. Michelle Sove Yanyat, Swaganisio, Danongania Gahaga, Niwago Wajona, Aguasasne, Nidi Wagenu. Please allow me to offer a brief prayer to start our behavioral health plenary panel. Creator, we thank you for our traditional teachings, one of which is to honor and respect each other as people. Thank you for reminding us to give thanks and greetings to the natural world. Thank you, Creator, for instilling in us that by remembering our language, our culture, and our ceremonies, we have all that we need to be of a good mind. Eto Niotonhak ne Ongwahni. Let it be that way in our minds. Yawa, next slide. Thank you for joining today's behavioral health plenary. Behavioral health is fundamental to the well-being of our country's children, youth, and families. Indigenous peoples continue to face the impacts of COVID-19, historical and present-day trauma, healthcare inequities, and all the while facing extreme health disparities. Agencies and offices across the Department of Health and Human Services are working together to advance behavioral health for children, youth, and their families, with an emphasis on improving access, promoting equity, and fostering innovation. The panelists today will provide multiple perspectives, including Administration for Children and Families, tribal leadership, and other partners working on tribal behavioral health initiatives, including current and future implementation of activities, funding, and resources related to addressing the behavioral health needs of tribal children, youth, families, and communities. We received questions in advance of this session, and many of the topics raised will be woven into each presentation. We would like to engage with you on ways to improve and integrate collaborative action and strategies to reduce the impacts of historical, intergenerational, and present-day trauma, reduce substance abuse disorders, and increase holistic health and healing. So we encourage you to reflect and provide additional thoughts and questions during the panel using the chat or Q&A feature. We are saving some time to answer questions for you. So please raise your hand and ask a question of the panel when we get to the Q&A session at the end. Next slide. Please let me now introduce you to our first presenter. Loni Greninger serves as Vice Chair of the Jamestown S'Klallam Tribe, as well as the Deputy Director of Social and Community Services. Among her notable accomplishments, she currently sits on the Governor's Oversight Board for the Washington Department of Children, Youth, and Families, is the chair to the Washington State DSHS Indian Policy Advisory Committee, and participates in local work groups to further education and resources between the state and tribes. One of my favorite things is that Loni also received her S'Klallam language certification in June 2019 and is a song and dance leader. And last but not least, Vice Chair Greninger serves on the ACF Tribal Advisory Committee as an alternate delegate. Loni?
Thanks, and Michelle, and thank you to all of the participants who are here this afternoon. In my native language, Nustayam Mutsin, Ait Tong and Siam Nisjaya Chasiam, Yuch Sian Snatch, Statisham Nustayam Sin. My name is Loni Greninger. I am Yuchsia in my native tongue. That name was given to me by my grandmother when I was 15 years old, and so I bear that name very proudly as I walk on this earth with a good step. Not only advocating for my own people, but for all Indian people in Indian country. And so it's a very honorable thing for me to be here. I'm so humbled and privileged to be able to speak to you today about things that are close to my heart. Behavioral health is close to my heart. My family, unfortunately, was riddled with alcoholism, and my father was the first in our family to break that cycle. And with him breaking that cycle, he actually, he influenced other members in my family to break the cycle as well. And he spent a lot of time being a chemical dependency professional. And then even after that formal work was done and over with in his life, he continued to reach into youth's lives who were struggling and shared his story. And then they were influenced to seek recovery. And then, you know, on the flip side, you know, mental health therapy, it's close to my heart as well. Unfortunately, my father passed away last year. And so I have been seeking, you know, mental health help to get me through that journey. And grief is hard. I'm sure there are many on here who understand that very well. And so I'm just so thankful for what our people and our tribes and our communities can provide us, as well as the greater communities that surround us. And I think that's actually a great segue into my next slide. So if we can advance the next slide, thank you very much. I want to start off with this theme first of behavioral health in Indian country and the value systems that we at the Jamestown Squalum tribe view this through. There's a particular quote, and I see it there on the screen, that our chairman here, his name is Ron Allen, he taught me this. You know, he said, we have to be able to coexist respectfully and responsibly. We're here together now with non-natives. We are here sharing these communities and these lands now. And when I think about that phrase that he said to me, I think about my grandfather from 7 generations ago who signed our tribe's treaty in this area. And that was Chief Cheechmahan. And you know what? I noticed in his quotes, in the historical records that we have of him, he said the same thing, but in a different way. He was the one that told our people back then that there is only one way to survive, and that's if we work together. And yes, he was talking about literal living. You know, we have to be able to exist as a tribe still, but living in our cultural identity, we have to be able to coexist respectfully and responsibly if we want our people to live, survive and thrive, if we want our lands to survive and thrive, if we want our language to survive and thrive, we have to learn how to coexist. And so that when we're talking about any of our services, and I'll explain a little bit about what Jamestown does here locally, when we talk about behavioral health services or any of the services that we do here at Jamestown, this is the lens we're looking through, that coexistence. But coexistence respectfully and responsibly also means taking that indigenous knowledge perspective, that deep, deep, deep well of cultural and traditional knowledge that each of our tribal communities have. Gosh, those roots, they go so deep that we can't even measure them. And I think you all understand what I mean by that. We can't measure that depth of knowledge. And in fact, it's a type of knowledge that can't really even be explained with the English language. It can be better explained in our own native tongues. And sometimes even our own native tongues do not have certain words for certain actions or certain feelings. So there's a depth there. And when we take that indigenous knowledge perspective, we start noticing very quickly that it doesn't seem to match, or it doesn't coincide well, or there's a lot of tension, there's a lot of barriers, or there's a lot of, I'm going to use the word fighting in between this Western knowledge perspective where we get science from, you know, and the testing of data and these evidence-based practices. And so what we have found at Jamestown, what we have to do, part of this coexistence respectfully and responsibly, means taking our ancestral, traditional, indigenous knowledge and looking at the best of Western knowledge and what it can provide us in our communities and our peoples and to our lands. We weave those things together. And I want to even give this visual, like, look at my hat, how that's all woven together, that nice cedar bark. I want to use that particular visual for this weaving of knowledge perspectives together when it comes to behavioral health. Because how many times have we said over hundreds of years as tribal peoples, our culture brings us healing too. It's not just medications through Western science or evidence-based practices, but we are finding that we need both for our community members to heal again and have that full-on holistic health. So that's a huge lens that Jamestown uses as we're moving forward with a good step. Next slide, please. I just want to talk about this picture here. We have President Barack Obama, but then also our chairman, Ron Allen. You know, when we're looking at tribal leaders and how we advocate for behavioral health, we go straight to the top. That's how it's supposed to be. Sovereign to sovereign, government to government. So when we are advocating for our people, and goodness sake, especially for behavioral health, we got to go straight to the top. We got to be able to show the President of the United States and all of his staff and agencies below what it means for us to have what we need for our people and our communities and our lands. And one of the things that we want to be able to communicate to our federal and state partners is that when our people are healthy, our lands can be healthy because our people help our lands. And it's vice versa. If our land is healthy, then our people are healthy. And when both of these are healthy, then we can actually increase our sovereignty, increase that manifestation, increase our healing, increase our culture, and so on and so forth. So when we are advocating as a tribal leader, all these things that you see on the screen, these bullet points, it's just a few of the things that I do. Okay, so I'm wanting to make sure that I am building relationships because I need allies. I need allies to help me. I need these federal and state partners to help me to get the right services to my people. And that includes me advocating for some certain flexibility and acknowledgement of the culture within these federal and state programs and funding mechanisms. You know what, and I think I'll pause there for a moment on that slide. Let's go ahead and advance. Because I do want to make sure I, in my time here, yes, that I talk about what Jamestown does so you can see some practical examples. Now, our behavioral health program is divided into two departments right now. So social services is where my realm is, and then we have our Jamestown Family Health Clinic, and then an additional clinic, the Healing Campus for opioid use disorder. So one of the things I wanted to highlight, and I hope this link, maybe we can put it in the chat, but this healingofthecanoe.org. This is something that came out through our sister tribes here, the Port Gamble S'Klallam and the Suquamish tribe. They put together this curriculum specifically for youth when it comes to behavioral health promotion. You know, you want to promote the good things of behavioral health, but also prevention of the things that we don't want our youth to be experimenting with, or maybe there's certain traumas that they're encountering, and we want to be able to help heal that or prevent further trauma from happening. The Healing of the Canoe curriculum takes our culture. It takes our culture of what it means to be in the canoe. What does it mean to pull the canoe together, paddle together, be united? You have to be healthy in order to help your partner pull her, right? So it's all about taking these life skills from the canoe and then putting it into your daily life. So I definitely encourage, oh, thank you, Michelle, for putting that in there. I would definitely encourage folks to check out that program. What's interesting is this program actually went through the hoops, I would call of Western science, you know, to get into a promising practice model. So it's close to evidence-based, which means that we have Western science acknowledging this cultural practice as a way of healing for our youth. And then I'll just briefly touch on our family health clinic side. This is where you get more of your, I'm going to call it Western traditional therapeutic services, where we do urinalysis, chemical dependency screenings and evaluation, or we'll refer out. We have mental health therapists. And then right now we are close to opening up our new healing campus for opioid abuse. So this is medication assisted treatment. And we are expecting to have between 250 and 300 clients that are going to come in for holistic services. They will get their dosing of their medication, whether it's Suboxone or let's see, Vivitrol. There's a couple others that I'm unfortunately forgetting the names at the moment. I'm sure those names are coming to your head, those types of medications, for those of you that are more familiar. But they come in, but they don't just dose and go. They come in, they get a therapeutic appointment, they can get dental work done, they can have a medical appointment done, and you can bring your kids, you can have childcare. You know that your kids are safe in one of our places of care while you are getting your own care. And then we also provide transportation. So these are the things that we just a few of the things that we try to offer our people, because behavioral health is important. We need our spirits, our minds, our emotions, and our physical bodies healed. We need all of this happening at the same time so that we can come together as a healed people and move our sovereignty and our cultural identity forward. So with that, I know I've probably gone over my 10 minutes. Sorry, panel. I'm so passionate about this particular subject, and I will look forward to any further questions and answers from our group today. Thank you so much. Ningsen.
Now I'll go Loni for sharing your insights as an Ongwe Indigenous person, as a tribal leader. Next, I'd like to welcome Dr. Martha Okafor. She is a senior advisor with the Office of Early Childhood Development at the Administration for Children and Families. We invited her here to join us on this panel because last year she was detailed to the Office of the Assistant Secretary for Health to function as the executive director of the President's COVID-19 Health Equity Task Force. Dr. Okafor will share some of the COVID-19 Health Equity Task Force recommendations. So off to you, Dr. Okafor.
Thank you, Michelle. And thank you to everyone that took the time to join us. Grateful for the opportunity to present. Next slide, please. So could we go to the next one as well? Thank you. So last year, I was asked to function or serve as executive director to the President's COVID-19 Health Equity Task Force. So this task force was put in place with the Executive Order 13995, which the President signed in month of February last year. And then the task force was put in place to actually guide the President, the White House, on recommendations that will, one, inform how to respond to the COVID-19 in an equitable way. Two, is to really make sure that every community in America is recovering equitably. And the third one is to inform the President on what to do to prevent the next pandemic, people actually being burdened with inequities that we all went through, especially minority, people of color, and others that felt minoritized. Next slide. So during this last year, when we did this intensive work, 320 recommendations were issued from February to July. And I'm happy to say to you that 80% of these recommendations that the administration, Biden-Harris administration, has taken some action on them. And the reason is because every month, the people that were appointed by the President huddle together to discuss what is happening. We listened to a lot of people, tribal leaders came. We even have a tribal leader as part of the people that the President appointed. And every month we issued recommendation. At the end, 55 recommendations out of the 320 recommendations were prioritized for the administration to complete action on them with outcomes. What you're seeing on this screen are the 4 major outcomes that those 55 and all the recommendations are supposed to result in. One is recognizing all of you, community members, tribal members, as experts that should be at the table to elevate the issues that are experiencing as well as the desired outcome you wanted. 2 is to make sure that we center equity in what we are doing, process, policy, practices, that no one should feel less than in this country, because when we do that during pandemic, things get worse. Another one is how do we collect meaningful data so that we will know who's left behind, who's doing well, and where we need to actually take action. And what are we doing that we need to stop because it is not helping everyone to be healthy. And then the last one was really to make sure that everyone receives comprehensive and equitable access to healthcare. Next slide, please. So we move to the following slides. I'm going to give you examples of some of the behavioral health ones that are very important. As you will see from this particular slide, I'm not going to go through reading them. I'll pinpoint important things for you to bear in mind. On this particular slide, it's talking about actually access to comprehensive behavioral health, which will include the mental health and substance use issues. But the point of emphasis is that the task force wants these services to be continuum, which means it includes prevention, such as providing information and help about suicidal behaviors, early intervention, as well as information to address stigma that a lot of minority people are experiencing, including the tribes. Next one, please. On this particular slide, it is talking about requiring that the administration partner with everyone, especially the federal government, with states, local tribes, and territories. And again, you will see the look up to all of you as experts that will help in developing a standard for behavioral health. And that standard will be comprehensive, but not only that, that it should be appreciative of traditional belief system that everyone is bringing, especially the tribes. As you know, the shutdown during pandemic and the social isolation during the peak of this pandemic stopped and halted some of the festivals that you guys do, which creates balance and harmony in the tribe. And when this was halted, the proposal, this particular recommendation was indicating that in recovery, the federal government should work with the tribes so that you restore those important traditions until desired outcome of healing and mental health is attained. Next one, please. On this particular slide, the most important for you to look at is really describing what needs to happen with people with disability and taking this continuum for behavioral health care and saying that for people that actually have disability and adults also in the tribes and other areas, that we have to make sure that people that want to receive care at home, that they are served at the same quality level instead of looking up to congregate settings or institutionalized care as our default. So it's basically saying we need to shift from over-reliance on having elderly and people that have disability in institutional care to serving them at home and with people they love and their culture and beliefs. Next one. In this particular slide, the recommendation is about long COVID. We don't talk a lot about long COVID, but it's important for everyone to know that the long COVID is happening and that in this particular piece is how do we look at addressing long COVID and looking at what's happening with children, youth, and elderly people to make sure that long COVID, what we are learning from long COVID, that we are sharing information with tribal Indian health services, rural health clinic, and other safety net, because the federal government is funding and centers to learn and figure it out. And the question is, how do we make sure this information is going to others, safety net, health system, as well as resourcing all the safety net to be able to do equally the same thing for their community. Next one, please. This particular recommendation was put in place because, like I said, many people are not talking about long COVID. And the issue is that it's estimated that about 20 million people will suffer from a range of long COVID symptoms. This starts from fatigue, brain fog, different things, depression, anxiety that are related to the COVID sequelae. So the question is, how do we make sure that you're communicating to tribal members about, and also indigenous people and people that live in your tribes about the symptoms of COVID, long COVID, in a culturally and linguistical way? So you build awareness And then we are able to link people to necessary services, especially the mental health and substance use issues that are relating to people coping in a negative way to long COVID symptoms. The next one. This particular one was really put together. I selected it because of the telehealth and telemedicine. And we know that it actually helps us to increase access to care. But also, we also noted that there is a Wi-Fi inequities, digital divide, and with some people in the tribes that we don't have that access. As a result, the task force strongly recommended telephone visits and saying that the same telephone and the telemedicine, which was done through the Wi-Fi, the digital visual website, should be the same, and people should be compensated providers for provided as long as they have quality care in both. Thank you. The next one, please. So that because we identify that many people don't have Wi-Fi and broadband access, the task force also recommended that the federal government should strengthen access to provide this broadband internet in medically underserved community. And actually the tribes were also included as one of those to close the digital divide. Next one. In this particular slide, I wanted to identify the workforce capacity, because the workforce capacity was important for the task force to talk about. The reason being that, as many of you, as you heard from Loni, it is hard to serve people without really engaging others that live in the area to serve. So we wanted workforce, especially with behavioral health, because behavioral health has a lot of cultural, traditional, and spiritual elements to it, that it is important to really develop our workforce in this area. And there was another recommendation I didn't bring here, but that recommendation actually requires federal government to provide loans and grants in order to do this work. Next one. Give some examples with children and families, since that is the community, the population that we also wanted to touch on. On that, this was really what the task force recommended should happen during public health emergency. In this case, they wanted the federal government to prioritize looking at providing all the social determinants of health, like food, housing, shelter, just workforce security for people. I remember during last year when we met with a lot of the tribal leaders, that while we talk about food, they made sure that White House understand that it is not regular food for a lot of the tribes. That we're talking about hunting, we're talking about fishing. It's not just grocery store. And when the pandemic came and people couldn't do hunting and fishing, that impacted a lot of the tribes' source of maintenance in terms of food, and how could the federal government expand that definition? So this actually expanded what we meant by food security, especially for the tribes. The next one, please. This one talks about access to them healthy food options. So being cognizant of the diversity and variability that in the tribes is different. For example, even when there is grocery store, just transportation, moving from one village, one track to another, that sometimes is like 2 days kind of trek or 2 days kind of, travel. So the question is, how do we expand the nutrition safety network programs using technology? And there was even discussion about dropping some of this food in the villages, in the common places that the tribe felt that they were needed, instead of relying on the traditional places. Next one. Another point that came into play during, and these are all official recommendations that you can easily access. One was actually supporting schools in meeting family needs. And the recommendation was really looking at schools as a place that people gather. And as a result, how does the federal government invest in full service? It's like creating a hub in the community schools so that, physical health, dental, vision, and social-emotional, like behavioral health services are provided, not only to the children, but using that site to extend services to families and other members of the community. One of the things that came up during this was really making sure that the full service includes interventions that will address the historical and present day traumas, as well as providing other social services beyond educational needs for the students in the location. Next one, please. This slide and this recommendation that I picked it because it talked about really looking at emphasis on how similar services should be provided in early care settings, like settings where you have children that are, head starts, like childcare settings, so that we do the same thing that we plan to do in K-12 schools also in those settings. But another piece that came up here, I didn't pick up that recommendation, but it was a second recommendation to this one, was making sure that where parents and children couldn't be at the school, that we provide home-based care and consults to parents at home that are of equal quality care and level. Next slide, please. This one talks about virtual education infrastructure. And the issue is really to make sure that our schools, both in tribes, all other places, especially areas that are marginalized, like the tribes and other locations where minority, underserved population are staying, that the schools are well equipped, teachers are well trained to be able to shift from in-person classroom to remote learning, and that resources are given to not only the teachers, but the children and their families so that they could study well back then. Next one, please. And this one is the last slide, I believe, and is about really funding the Indian health services, recognizing that Indian health services are not funded at the same level as other health services, and making sure that the federal government fund them, because that's where a lot of families receive behavioral health care, but not just fund them in a way that is so stringent, but fund them in ways that they will be able to provide continuum of behavioral health care that I mentioned, from prevention to treatment to recovery support that are culturally and linguistically responsive. And that completes my slides. Thank you so much.
Thank you, Martha, for highlighting how the COVID-19 Health Equity Task Force is recommending the federal government support behavioral health and health equity, especially for our Indigenous communities. Our final panelist will be Dr. Marilyn Zimmerman, who is the co-principal investigator and senior director of policy and programs at the National Native Children's Trauma Center. I wanted to read more about her bio, but we're running short on time. Please read up about Dr. Zimmerman, because I don't want to take a minute away from her presentation.
Thank you so much, Michelle. Just a quick, I am Nakota and Dakota from the Fort Pecos-Bourne Sioux reservations we reside in the northeast corner of Montana, but I currently serve as the senior director, as she said, at the National Native Children's Trauma Center at the University of Montana in Missoula, Montana. Next slide, please. So what I want to bring to this part of the conversation, and I'm jumping right into the presentation without much preliminary context, but making sure that trauma is a part of the conversation and trauma is a part of the context when we're discussing behavioral health needs and issues for Indigenous people in America, and families and communities. So the first is that I want us all to understand that if something is traumatic, it is the experience of the individual that has perceived a real threat to the life or safety of themselves or a loved one, and it has caused overwhelming sense of terror, horror, or helplessness. So think about a family of 5, and there's a dramatic event that happens at a holiday, and in adulthood, all 5 children talk about that event differently and how they had different perceptions depending on their age, their developmental trajectory, where they how old they were, and the sort of supports that they received afterwards. So none of us can ever say to another person, well, that happened to me, and so I got over it, you can get over it. Or we can never say to a relative, oh, that's not a big deal, come on, get up, get going. And so that's where I want to talk about how we do service delivery in behavioral health settings that don't necessarily address or account for trauma as part of the services provided. Next slide, please. So we're not talking about those acute single events like a Katrina, a house fire, a range fire, a flood. We're usually talking about chronic or multiple types of events that occur in the life of a child. And later on, as we get older, the life of adolescents and adults. And what the Adverse Childhood Experiences Study did not take into account was the collective traumas that groups of people like American Indian tribes experienced. And they don't take into account today's challenges with structural violence against us, as in, for example, Indian Health Service being funded at 50% of need for the last several decades. That is a sort of, we're not able to take care of our own as a treaty right. And in the other part of it being that we have to really understand that complex trauma is where we're mostly living with our children and our families. And complex trauma is not just different types of trauma or the same type of trauma that experienced repeatedly, but it depends on the personality of the child and the circumstances and the supports that they have and the long-term and developmental impacts. And very often we're talking about complex trauma in the context of they are experience these traumatic events and this neglect or these traumas at the hands of their caregivers. And of course, we're going to talk a little bit right now about historical trauma. Next slide, please. So some examples are, of course, we've all heard about the diseases, the smallpox that were brought to the tribal nations that we had no immunity for them. Lots of tribes experienced starvation once placed on reservations. I know the tribes of Montana all have their winter starvation stories that is a part of their collective trauma. All of the practices of colonization were detrimental to the well-being of American Indian, Alaska Native, and Pacific Island people because of the colonization strategies were genocidal in nature, the forced migration, relocation from our homelands, where our foodways and our medicines lived. So they removed us from the way that we heal ourselves and took us to a different place. And we had to find the healing ways in that particular place and bring our grandfathers and everything with us. The loss of children, of course, the removal of children in child welfare scoop of the 50s and 60s, and the boarding schools in the late 1800s, and some still exist today. Criminalization of our spirituality, again, those ways that we have of healing ourselves were made illegal. And then, of course, what some say is the incarceration on reservations, which we have turned into and changed the narrative and turned those into our homelands from where we build healing and resilience. Next slide, please. So here's some of the impacts individually of historical trauma, of the collective experiences of our tribes, our families, and our communities. So individually, we came back from boarding school experience with often a very weak ethnic identity. We of course had behavioral health disorders like anxiety or depression. We weren't calling them that then. We have poor health outcomes. We continue to mistrust the very agencies that have been put in place to support us, like Indian Health Service and behavioral health, or Department of Interior and BIA and Bureau of Indian Education. So we're very distrustful today. Family impacts, again, those severed family roles, the loss of our cultural, nurturing, wholesome, vibrant parenting ways. The community impacts, I know that service providers in our rural reservation communities, lateral violence, where we bring home the feeling of the things being pitted against each other as the students in boarding school. Lighter American Indians fared better than darker. Sometimes the nuns and the priests or the government officials would pit children against each other or tribes against each other. the chronic poverty that we continue to experience. We are a healthy, brilliant, talented, artistic, loving, nurturing people, yet we continue to struggle with poverty and unemployment. This is directly connected with the loss of sovereignty. We have those community severed roles where we don't know who we're supposed to be within the context of not just our family, but in the context of our community. Next slide, please. So I just want to give this slide and pay the last few minutes special attention to some of the key messages of trauma. So we can look at the impacts of the emotional development, cognitive development, relationships, and behavior. And I'll let you guys all just take a look at that. I'm assuming that they will have the slides once this is done. Once this presentation is done, they'll have access. So just looking at very briefly, again, impact on difficulty with self-regulation. If we are often raised by dysregulated parents, and dysregulated parents often have dysregulated children, and the way that children are able to maintain relationships, manage their behaviors, be able to attend and concentrate and memorize is to be able to self-regulate themselves. And so it's a big piece of that conversation. Next slide, please. And so finally, I just really want to bring this home. Trauma is prevalent. We know that from the ACEs studies in the 90s, and now we're having much richer conversations across the United States, but trauma is prevalent, not just in Indian country, but across the United States, but in particular in Indian country. I want to remind us, it's not the event itself, it's how a person experiences it. Trauma impacts us across domains. And here's key to any sort of conversation that we have about how to serve people who have experienced trauma. And that is to always ask ourselves, what is the function of the behavior? Whether it's a Head Start student, what's the function of that tantrum? What's the function of that behavior? Or it's a person that is coming into your services for substance abuse issues, and they get either big and aggressive, or they get timid and small. It's all those kinds of things. What is the function of the behavior? Start to ask that instead of saying, blaming people. So there's some behavioral and emotional adaptations that maltreated children and adults. It's all about survival. They are always in survival mode. So they're surveilling their environment always for safety, and not just physical safety, but emotional safety. And some of the solutions they come up with are brilliant, creative solutions, but they can be personally costly. So thinking about two young ladies that we worked with that came to our attention on my reservation, they, for truancy, found out that they were living with a perpetrator. They had to protect themselves so that meant that they didn't get to bed till 3 or 4 in the morning, because that's when he went to bed. Well, so creative, brilliant solutions that these sisters came up with, but one was in danger of not graduating from high school, and one was in danger of not moving on in school. So personally costly. And then if we don't look for acknowledged trauma in the lives of children and adolescents and adults, we end up chasing behaviors instead of asking what's the function of the behavior, and going and thinking about and talking about and understand the impacts of trauma on our well-being. Finally, resilience can be learned. Healing is not just possible, but it is probable. Thank you, everyone, for your time.
Thank you so much for that presentation. And yes, we will definitely make the slides and the recording available. But we want to engage with you. We hope you heard some of the questions that you asked ahead of time reflected in the presentations you heard. But you can now ask questions either by raising your hand, using the raise your hand feature down below, or you can put your question in the chat if you prefer to do it that way. And so I believe we'll have all presentations and slides available on the conference website. And I'll read a question here. As a language focused program, I feel out of my depth when trying to answer, okay, sorry, I lost my spot here in this chat. gotta find it. Let me move it over here. Sorry, everybody. Okay. Okay. Trying to answer this question. Does teaching tribal languages to tribal members who are in addiction recovery help? My instinct is yes, but I don't have any experience or education in this area, so there is very little weight behind my opinion. Are there studies or experts that have focused on this? Are there best practices for this intersection between the humanities, tribal culture, and healthcare? So I will turn it over either to Dr. Zimmerman or even to Vice Chair Greninger to provide their response.
So I would say absolutely, there have been research studies. I don't have them off the top of my head or at the tip of my fingers here, but we do know that any sort of, for example, I'll just give an example on my reservation. We were working with some spiritual leaders who were bringing young people into sweat lodge ceremony, which is a Northern Plains tribal ceremony that talks, or that is a cleansing ceremony and a healing ceremony. And one of the things is that the children, the adolescents that were coming and their parents had no exposure to their language, had no access to learning their language at the time. And so part of participating in that healing ceremony is learning the sacred songs and learning the sacred prayers. And that meant you had to learn them in the language of our people. Because if we wanted to talk to the grandfathers about our relatives, we had to talk to them in Nakona or Dakota, right? So that they could hear us. And so that's a very brilliant example of, I think, of starting there and creating a deeper sense of identity and connectivity and connection to the tribe and to their families. And all of that, all of those ways have been found to be protective or resilience building.
Thank you. Thank you so much for that response. And I believe we have a raised hand from Sornha.
Hi, good afternoon. Thank you for taking my comment. My name is Sorna Lee. I am with the Scotts Valley Band of Pomo Indians in Northern California. I'm the CFO and interim executive director for our Tribal TANF program. And I just wanted to recognize the importance of expanding telehealth and telemedicine access and that reimbursement. But I wanted to caution that we don't find ourselves moving so close on that pendulum that healthcare providers see that as a way to avoid in-person conversations, because people need those in-person conversations just as much as they need that telehealth and telemedicine option. And so I just wish to recognize that we be mindful of not ignoring that, particularly in the behavioral health environment, where that personal connection and that ability to do some of that therapy, some of that DBT and EMDR therapy, where you really need that in-person experience, or maybe not everybody does, but a majority of people do. So I wanted just to take a moment to reiterate the importance of that.
Can I just add something to that? Because I agree, it's sort of like all avenues or all sort of ways of finding healing and hope and restoration to ourselves as individuals or as families or communities. And it really is the behavioral health conversation around with the foundation in trauma really creates an opportunity for relatives to support one another. So for many rural reservation communities that exist in the United States, and it looks like there's not enough MSWs or master's level or PhD level clinicians. Therefore, we have to look to our culture, our ceremonies, our language, and each other to find that support. And finding that support is really thinking about and addressing the impacts of trauma on our well-being.
I wanted to thank you so much, Dr. Zimmerman. I wanted to just say to the person that asked the question that recommendation is in line with what you're saying. The recommendation was to use telemedicine to increase access, especially where it is appropriate. However, the most important recommendation is to actually provide continuum of services that are culturally linguistically appropriate. And when we talked about the tribes and our indigenous people, we also mentioned the need to really include that integration of traditional healing and the spiritual healing in the mental health and behavioral health. So the recommendation actually touched on all of that. I think the question is, you have an opportunity. Sometimes the provision is there, but people are not taking the opportunity. I know you have the opportunity to do that, to continue to do what you just asked if you can. You don't need permission to add language because it is important and integral in the person identity and how that person sees wellness and how the person experiences the dysfunctioning or the illness. So you actually have a responsibility to do what you're doing because you know it is meaningful and it will help to achieve healing for that person. So I will encourage all of you to look at what you may be waiting to get permission and just move on doing what you know that is right for the indigenous people. Thanks.
I'll just briefly follow up on that comment as well. You know, as a tribal leader, when I hear a comment like that of, okay, here comes a new resource, but don't pendulum swing so much that we forget about all of the good things that we've been doing before. Let's not forget our culture. Let's not forget the value of face-to-face visits. So important. So my brief comment would be this: as a tribal leader, when I hear something like that, it reminds me that what I need to do then is provide the vision to my health clinic director and his or her staff to train those providers to say, these are our cultural values, face-to-face, always first. And then at the same time, what I'm also thinking about is, and I don't think this is what the commenter was saying, but I'm just saying this out loud to bring the balance in my mind as a leader. Prioritize face-to-face visits. We got to get people in the office, see the whites of their eyes, see their skin color, see what the, like we got to be able to, touch them and be able to hear their heart and all of that. And then if I have somebody who's feeling a little bit apprehensive about coming in for maybe a mental health therapy appointment and they say yes to a telehealth, then I'm going to make that available too, until they're comfortable enough and trust me enough that I can reel them in to see them in person. And then we form a better, deeper bond that way of trust. So yeah, I absolutely see the balance there. But anyways, the concluding theme for me being, it all comes down to me as a tribal leader, passing down that mission and vision to my clinic, to my providers, and to all of those staff who run those programs. Thank you for that comment. That's super important. We got to keep balance in mind.
Thank you. And before you go off camera, I'm going to see if maybe you want to address this question. How do we balance the fact that not all tribal families or children participate in tribal cultural ways, especially from the spiritual ceremonial standpoint? Sometimes we focus on the cultural aspects and do not strategy to use other community resources.
So Michelle, is that directed toward me?
I thought so, because I was thinking of your slide where you had both,
yes.
both sides.
Yes, absolutely. I will start off on this one. So with Jamestown, we particularly are sensitive to this because we do understand that not all of our tribal families share same faiths. We understand that even our families don't share same values on what medical or behavioral health care for them should look like. And so we do try to provide as many options as possible. We have folks who are more comfortable with those traditional practices. And so we are in the middle right now of trying to figure out how do we perform a sweat lodge in the safest way. We have recovery groups that are very culturally oriented. But then we also have services where if folks are more comfortable with more of that Western science model, we will handle that too. We will offer that to them. And we, coming back to that sharing of Indigenous and Western knowledge perspectives, right? We want our doctors, our people, and even our non-Native allies who come to work for us, we want them to go out there, learn the Western models, bring it back to our people. And then where our folks are comfortable with embedding that Indigenous knowledge into it, great, we will help with that too, and we'll bring those cultural supportive models in there with it. But we will offer the gamut, at least here in our community. And as a sovereign nation, we have that choice to serve who we want to. So we offer these options to our people and to other Native Americans. And then we also offer services to the greater community, not necessarily our ceremonial and traditional practices. That's more reserved for our own community members. But if you're talking about the greater community of non-natives that we also serve, we offer, I would say, maybe not the traditional practices, but the provision of services that we do offer still have cultural values woven into them, even if they're not super apparent or overt. But our value systems and care for them as our greater community, you know, we bring them in with us, we put our arms around them and say, you're our family too. Those cultural values are there, but maybe they're just more silent. So I hope that answers that question. We just, I guess, if I were to bring it down to a short answer, we provide the gamut because there is those needs of being able to meet everyone's needs and comfort levels.
Agreed.
So I would like to just make a note on the elderly piece, the role of elders, because part of the recommendation is really strongly encouraging that we use multidisciplinary. So the elders could be part of your multidisciplinary team when you are providing care, and they could be paid as part of your multidisciplinary. So it's not just for them to provide services, but they could actually be paid. Another one is training the elders as recovery support specialists. So there are so many nuances in this recommendation and in the new policy direction that will help a lot of you. The question is you knowing that it exists, all those things that exist, and taking that opportunity. But that could be for another discussion. Thank you.
Thank you so much. We have about 1 minute left. If you have additional questions, you may send them to this ANA commissioner at acf.gov. We'll share it with all of the panelists and try to answer them as best as we can. I will turn it over to Hope McDonald Lone Tree just for a really brief closing.
Thank you, and my heartfelt appreciation to Dr. Zimmerman, Vice Chairwoman Greninger, and Martha Okafor. We greatly appreciate your expertise, how you are compassionate about our people and passionate about what you do. This is all important about how we are supporting our Native brothers and sisters and Indigenous communities here and across the country. So I want to give you my heartfelt appreciation. We had some conversations about traditional medicine, and we know that this has worked for us as Indigenous people for centuries. We have healed ourselves, and it is the reason why we are here today, for the wisdom and the care that our ancestors had in sharing what was important to us, what we valued, and the importance that the land and Mother Earth has provided us in our healing. So again, we thank you for being with us today. Please continue to share your comments that you have, how different ways that we can support you. We will continue to build bridges and create partnerships so that we can affect what is happening on the ground and provide you the services that you need. So again, and please have a wonderful day, and we will see you at the next session. Thank you.